Good. Welcome to True Health Tuesdays. Today it's hiatal hernias. Okay, now this, when you find out the real actual cause, you're going to find out that, God, Doc, you could put that talk together in about 20 minutes. I thought so until I looked up the medical therapies that they use for hiatal hernias, and I delved into the world of the psychotic and stupid. Okay, so we're going to go over hiatal hernias. Okay, and the simplest thing, imagine you've got a diaphragm, which is a breathing muscle. Okay, every time you breathe, it goes down, and the lungs, there's a negative pressure in the lungs, so the air flows in the lungs. Then it relaxes and it goes up like this. So you have this muscle that flexes. That's the diaphragm. Now you got a couple of holes in it. Okay, you've got one hole that carries the inferior vena cava, the main vein drain for the bottom, and you've got the esophagus, okay, that comes down. That's the food tube. And so what you're looking at in this picture here is a stomach, that's that curly-cue little thing, the diaphragm, and we're looking at normal and a sliding hernia, which is the muscle gets weak or it's not strong, okay, and the stomach kind of slides up inside of the cavity. Now, the problem with that cavity is that's where the lungs are. So this can have a number of different symptoms. Now, of course, it could get really bad where parts of the stomach can go up. Now, there's, if you can imagine, you're increasing pressure in the stomach. So what kind of things can cause that stomach to herniate up? Well, first, you need an unhealthy muscle. Okay, does that make sense? Because there's people that can get punched in the stomach, fine, no problem, you're not going to have an issue with the stomach. But however, if you have some type of an impact, or if you're coughing or sneezing, that increases intrathecal pressure, and if that diaphragm's weak, you can have a problem. So I'm thinking pretty easy fix. I mean, for hiatal hernia, there's actually a chiropractic adjustment that involves a fist similar to this, that you literally pull it down. There's also certain home fixes where you'll drink like a glass of water, you'll hold your arms up and you'll drop down like this, so you have that little weight to pull that stomach down as well. So there's a lot of little fixes, but it just involves a mechanical displacement where you're pulling that stomach down and then reinforcing the diaphragm. Okay, does that make sense? Okay, pretty simple. Yeah, that's what I thought. Okay, so you look at the medical therapies for it, it does, because you got to figure that part of that stomach is bulging up there, and there's a muscle there called the lower esophageal sphincter. And there's the muscle that tightens up and keeps acid in the stomach. So if some of that stomach goes up there, you start to get this reflex symptoms. So even though it's a mechanical distortion involving mechanical stuff where the organ is literally in the wrong place, okay, and the muscle is weak, we're going to drug it. And I'm going, are you serious? So they choose antacids. Now, because this gives acid reflux symptoms. Now, 50%, 1 in 2 Americans have acid reflux. That means that their body is trying to reject the stuff in there or the muscle on top of the stomach. We're going to go over acid reflux, but just understand, it's treated like it's acid reflux even though it's not acid reflux. Yeah, I'm sure that makes sense to someone. Okay, so this is why it was confusing for me, because I'm delving into this world. See, we fix hiatal hernias all the time. It's like a very simple procedure. This isn't anything unusual. So you look at the medical aspect, okay, we're talking like Medscape, all the big sites. What causes a hiatal hernia? Cause is unknown. And I'm going to show you the cause. If you don't know the cause of a hiatal hernia, you are absolutely ignorant about anatomy and physiology. Who's at risk? Obviously, well, women, that could be because of pregnancy. It's going to increase the pressure. That makes sense. Overweight, again, that's going to do it. People over 50, that doesn't make any sense, you know, unless they're over 50 and not in shape. How is it diagnosed? Of course, you can take some radioactive barium, swallow it. Yes, I know that's going to damage the kidneys. Okay, and then we can x-ray it. So a completely toxic, inefficient procedure to identify whether it's there. Now, I was shocked to find out there's 4 different types. Why not? Let's categorize it. 95% of them is that the hole in the diaphragm is weakened and it's wider, and part of the stomach goes up. Okay, I'm going to show you how simple this is to fix, but that's 95% of them. You get a couple where the structures around, because you've got this diaphragm here and you've got the esophagus coming down. So you can imagine, since the diaphragm is on the lung area, it's like a negative pressure. And so it's really sealed well. There's a lot of ligaments there. If those ligaments get damaged, then you get parts of the stomach and you get even parts of the intestinal tract, spleen, colon, going up inside of that cavity as well. And that's a rare one. Type 3 is a combination of 1 and 2, so we're talking weak muscle, loose ligaments causing this. Does that sound like a mechanical distortion? Yes. Yeah. Okay, now the big thing with hiatal hernias is it mimics stuff. Because since you have things taking up space in the pulmonary cavity or the thoracic area, it can mimic like dull chest pain, shortness of breath, heart palpitations. You swallow food, obviously it's not going to flow down, so people have real great difficulty. Heartburn, and again, they use antacids to treat it, H2 blockers and proton pump inhibitors. Well, first let's go over antacids, okay, and reflux. Reflux or indigestion does not come from too much acid. Indigestion, reflux, does not come from too much acid, it comes from too little. I know there's about 5 doctors zipping through and they just heard this and their brains explode. They go, no, we've been treating it with antacids forever. I know, now here, get this. Imagine the body's smart, okay? Now you got acid inside the stomach, a pH of like 1 or 2, okay, maybe 3. And this is incredibly acidic. Now that it's not going to damage the stomach because the stomach's designed to handle that. So you have a muscle on top of the stomach at the bottom of the esophagus, and we call it the lower esophageal sphincter, okay? So now when there's presence of acid in the stomach, it tightens up, keeping the acid in there. So what in psycho world, you're going to take an antacid, okay, and that's going to lessen the acid in there, but what does that do to the sphincter, the lower esophageal sphincter? It loosens it. So you're actually causing more of this damaging fluid getting in an area where it shouldn't. Also, let's look at other things. What other stuff would damage or cause the sensors in the stomach to not work right? What about water? You could dilute the acid. So if you're drinking water before a meal, during a meal, or a half hour afterwards, you're diluting the acid. Diluting the acid, what does that do? That loosens the lower esophageal sphincter. So there's a lot of causes for reflux, but mainly it's that the sensors inside of the stomach. Sensors. How do sensors communicate to the brain? So the nervous system. Nervous system. That's so good. Oh my God, you guys have been to some lectures before. Okay, so when we look at this, what kind of medications will cause reflux? We obviously know medications, can cause damage to the body. High blood pressure medications, medications for chest pain. Ooh, isn't that interesting? Reflux can cause chest pain, but if we take a medication to solve chest pain, it can cause reflux. Asthma, breathing problem medications, sedatives, anxiety medications, antibiotics, antidepressants, nitroglycerin, osteoporosis medications, pain relievers. Okay, so there's a huge list. There's certain foods that can be sensitive. But again, if I say that chocolate, ethanol, peppermint can have negative effects, they usually don't if your nervous system's healthy. So if these foods are bothering you, you got to find out the really cause. You really have to. Now, what was the drug they treat with it? Oh, proton pump inhibitors. And they give you this, and this is, any doctor that's still passing these out is either ignorant, because they can't call them illiterate, because they obviously read, okay, because they were able to pass some tests. The proton pump inhibitors, they give it to you and they say, this is going to prevent adenocarcinomas. It's going to prevent carcinomas of the esophagus, because we're going to lower the acid. What did we just learn? You lower the acid in the stomach, you lower the tension on the lower esophageal sphincter. What does that do? It actually damages the esophagus more. Well, according to the British Journal of Cancer, it increases adenocarcinomas. So the drugs they give you, the proton pump inhibitors that they give you to lessen your risk of cancer, actually increases it. I know, wow. Okay, now let's do some more stuff, because you're taking an antacid, something to lower your acid. You need acid in the stomach. If you don't have acid, you can't digest certain minerals. You can't absorb certain minerals. So you're talking muscle spasms, irregular heartbeat, convulsions, seizures, cognitive decline, type 2 diabetes, decreased DNA production, increased hip fractures, wrist, spine, high doses or long-term use. You're going to have fractures of the bones. Why? Because you're lowering the acid. You can't absorb the minerals. It's nuts to second guess it. But I want you, since anatomy is so important, I want you to really own this, what your body is like. The stomach has a certain lining to it. Produced by the goblet cells. It's a mucus lining. And this, so the stomach can continually get this acid production in there, and it doesn't damage the stomach. It's one of the most amazing structures ever. And the esophagus does not have those goblet cells. So we have to have good function of that lower esophageal sphincter. Otherwise, acid's going to continually flow up it. This is why you do not want to drink water a half hour before a meal, during a meal, or a half hour after, because it lessens the acidity in there, it raises the pH, and the sensors don't work. It's not, the lower esophageal sphincter won't work. Okay, does that make sense? Now I want you to look at, this is like a blown up version of the muscle layer of the diaphragm, the esophagus going through, and the stomach underneath it. Okay, now you can see that there's all sorts of connective tissue up there that's going up the esophagus, they're going down on top of the stomach. So this is a good sealant. Now I'm bringing this up because what controls the tone of that muscle? We know one of the main causes is a weakening or loosening of that opening. So wouldn't a strong diaphragm make sense? How do muscles get strong or weak? Obviously, this thing is being breathed, so I mean, it's moving all the time, 16, 17 times a minute, okay? But when this, so if it's moving all the time, what would cause it to be weak? I know, I'm going to answer in a second, okay? So I want you to really appreciate this. This is the top, this dome-like structure. We've got one hole that holds the vein going up, the other hole coming down has got the esophagus, and that dome-like structure is constantly being pulled down and gone up, pulled down and gone up. But wait a second, what was the mnemonic that I love using? Because I used to teach anatomy. C3, C4, C5 keeps you alive. That's the phrenic nerve. That's the nerve that innervates that muscle. Wow. So does that mean if you have a neck problem or compromised nerve supply in the neck, that can alter breathing function? Isn't that something? This is why I had such a hard time, because we know it could be a mechanical distortion in the neck, a mechanical distortion of the weakening of the diaphragm, allowing the organ contents to go up, even the insertion of the diaphragm. As if you look at this, that muscle actually has to connect to the ribs and the spine. So it's actually a brilliant design. So I'm going to bring up a patient. Her name's not Betty, but really, really sweet gal. Now, she comes in with fatigue. Why fatigue? Because she's taking proton pump inhibitors. And we're talking, this is her entrance form. And you think, what a sweet gal, but she's already had esophageal cancer. Guess what she was taking? Proton pump inhibitors. What did we just learn? It causes esophageal cancer. This is her neck. And what you're looking at here is loss of curve in the neck, degeneration right at C5, and that's her lumbar looking up. But see how it's distorted right at the base of the ribs? So we got the attachment points for the diaphragm are distorted, and the nerves that supply it are distorted. Do you think that's going to be a healthy diaphragm or an unhealthy diaphragm? Unhealthy diaphragm. So we're talking years of problems. She mentioned this to me, and I said, oh yeah, this is going to be an easy fix. So I put my fist in her stomach, and we pull it down mechanically. We get her neck adjusted, everything else. She's off the drugs. And I think she's a little upset because she was on drugs for years and she's feeling better. And it's like the definitive experts in the medical world never told her that this type of move, that mechanical distortion, could actually fix a problem. So this is a normal neck. Beautiful curve. C3, C4, C5 keeps you alive. So if we look at the body as responding intelligently, okay, it just makes more sense. Then we have to look at other things, because since we know the nervous system that supplies the diaphragm can alter it, you got to look at the three stressors. Because what else can weaken the muscles? What else can alter the nervous system? Physical, chemical, and emotional stress. And when we look at the stressors that's also causing this, so we're talking sedentary lifestyle, lack of moving of that diaphragm, lack of physical exercise is also going to weaken that. But what about an alteration in the autonomic nervous system? If you're under that stress, that physical, chemical, or emotional stress, the fight or flight system, the sympathetics is going to be firing off, and this is to keep you alive under short term. But if you're under long-term stress, you're talking blood supply to the gut is decreased. So you're talking the organ systems are not going to be healthy. Blood supply leaves the organ systems, goes to the arms and legs to keep you alive short term. But if you have long-term stress, the parasympathetic nervous system, this is the rest, digest, and repair. So if you're in long-term fight or flight, the diaphragm's not going to be healthy. The body can't regenerate itself. It's just a total imbalance. Today, our children are assaulted with chemicals. This is 69 doses of 16 different vaccines that's forced on you. Yes, forced medical procedures without consent. When they play this back 50 years from now, they'll go, there's no way the public would have stood for that. Okay, we got to go up in arms. Okay, we can't tolerate this anymore. We only have 8 more years before 1 in 2 children have autism. And, you know, if anybody that doesn't know that this is a causal factor, they didn't see my last talk. Okay, these are the kids that come in here. And I got to tell you, a beautiful, healthy, wonderful kid they're neat. They're fun to play with. Sick kids, they don't know anything. We just had this sweet little kid in, vaccine damage from Kuwait, and just the most darling kid. She was diagnosed with reflex sympathetic dystrophy syndrome, which is vaccine damaging a nerve that alters the blood flow, okay, to the extremities. And she was in such agony. Imagine this 10-year-old. She had to be on crutches. And it took her a month and a half to come in, and we put her on the fast track. And she comes in. I said, yeah, man, we could fix that quick. So she comes in. Within 2 days, she was off the crutches. And I told her, I said, honey, you didn't have reflex sympathetic dystrophy syndrome, which is RSDS. I said, you had BDS. She said, BDS? I said, yeah, hon, that's really dangerous, too. It's called bad doctor syndrome. You know? It's dangerous. And she was so cute because she went to the medical doctor, and here now, it's been a week into care. She has no symptoms. She goes in there, and she says, yes, it was so weird. I laid down, and they put cold on one leg and hot on the other, and they switched them, and I was responding normally. But he told me, he assured me, you'll never get over reflex sympathetic dystrophy syndrome. You'll have it all day, you know, for every day as long as you live. And she tells me, she says, that was BDS, wasn't it? I thought, oh God, you are so cool. Okay, so, I mean, you know, how could you not love? So, I mean, even though kids are irritating, let's not poison them, okay? They're cool. Here's another vaccine damaged kid. Okay, that's a leaky gut, not leaky gut. But again, these poisons, they're neurotoxins. What causes the hiatal hernia? Alterations of the nervous system. You know, again, I'm showing you a normal child on the left and the gut of somebody who's not normal because of the vaccine damage. All that black area down there, that's a leaky gut. So how do you heal this? Well, first, okay, you gotta maintain the microbiome. You got to get healthy bacteria in there. This is absolutely essential that you have lots of healthy gut bacteria. You've got to switch to an organic plant-based diet, absolutely. If you can't, look at frozen organics, okay? That's a cost-effective, appropriate alternative because they don't lose a lot of their nutrient values that way. Healthy fats, coconut oil, olive oil. I mean, there's so many ketogenic vegan diets that advocate high amounts of fat to help with tissue repair. Fermented veggies, probiotics, juiced vegetables, blended fruits, raw dairy. Well, it's still legal. Seriously, they're making it illegal. Reduce the toxic food too. There's a couple of quick tricks you can. I mean, one of them, obviously, drink no water 30 minutes before a meal, no water during a meal, no water a half hour after. Okay, and there's a couple of things. Raw unfiltered apple cider vinegar, tablespoon with a little bit of water, that can also help settle down some acid. But again, this is for reflux or acid, because if you've been on these proton pump inhibitors for a long time, and if you stop them, you can have a major rebound. I mean, major, and it could be extremely uncomfortable and damage your system. So here's some techniques that you can use to get it corrected. Bentane hydrochloric acid, this is an awesome supplement to increase the acid in the stomach. Any doctor that survived this long in this tape prescribed bentane hydrochloric acid for reflux instead of something to lower the acid. Yeah, bam, you just heard the head explode. Okay, baking soda. Okay, if you still want to decrease acid, which I don't recommend, okay, a little bit of tablespoon or half a teaspoonful in a glass of water. Aloe juice is really good. Problem with aloe, it helps with gastrointestinal problems, but it does have a laxative effect. Okay, glutamine is really good. Ginger roots, excellent. Slippery elm's good. And also adjustments. How about getting adjusted at C3, C4, C5? And this was actually me this past weekend in Vegas. So obviously, what happens in Vegas doesn't stay in Vegas. It was a really great conference. Oh God, it was fun. Okay, then you got to get optimal vitamin D levels. Why? Because we got to have a healthy immune system. Vitamin D works synergistically with the fermented veggies. I mean, that's literally it. When you're talking about hiatal hernias and something that seems, you know, so simple. It's a mechanical distortion. The muscle is weak. Strengthen the muscle. How are you going to strengthen the muscle? Let's look at the stressors that can cause it to be weak. How is that? Let's look at the nerves that supply it. I mean, we just need to increase the anatomy and physiology. But I guess the gastrointestinal tract guy isn't going to look way up here because that's really far away from his field of expertise. So you need to get a healthy nervous system. Obviously, you need to do regular exercise. That's going to strengthen the diaphragm. You need to get proper nutrition. Sufficient rest and prayer and meditation. You got to. Now, we got a new website that is incredible. And it's free. And it's worth at least 10 times what it costs. Thank God! I'm not the only one laughing at my sense of humor tonight. Okay, so, but this one, go to drjohnbergman.com. The cool thing is the disease database. It is just amazing. We keep adding to it, but it just gives normal, healthy solutions like this. But I recommend it. Okay, now, any questions? Does it always have to be at the top there? Can it be like down low here, something coming out? Oh, yeah, well, not on a hiatal hernia, but a regular hernia can be down there, absolutely. Yeah, a hiatal hernia. Like you push that down? Well, what you do on a standard hernia, like in the inguinal area or anywhere else, you got to strengthen the tissue in the area, so you got to look at the nerve supply. But also, what happens a lot of times is dehydration, that a person's straining too much to get the fecal material out, that it's starting to bulge it open. And then that also low protein production, so low acid in the stomach will weaken the muscles because you're not breaking those proteins to amino acids. So yeah, there's a lot of ways to fix hernias other than surgery. And the mesh is like crazy. Try and get them to sew it up inside, sew it up outside, but you got to fix the problem that caused it. Yes, sir?
So with that, do you need to do surgery, or can just nutrition and hydration?
On like a regular hernia?
Yeah.
Most of them you can fix non-surgically. The mesh I've seen so many problems with it. It would be fantastic if you can do it without the mesh, but you got to restore the nerves that supply it, clean the blood up so you have healthy blood supply, nerve supply. But if it's like in the middle here, where there's no muscles, because there's just a big line, you know, that six-pack that I have, where it goes in, that's called linea albuginea, okay, and there's no muscles that cross there. So if it rips there, it's tough. You gotta sew it up.
I've always had problems with hot sauce. Any type of hot sauce or hot peppers, I always get like a burning sensation. Is that still a hernia?
Kind of. It's a sensor issue. Because one of the things on peppers, and they have a chemical in there so that insects won't bite them, but it gives that like hot burning thing.
Right.
Your stomach isn't recognizing it as something digestible or with acid. So if you take something that your stomach will recognize, then the stomach's going to produce the acid that'll tighten up that lower esophageal sphincter and it won't go in. So if you're taking it with, like, say, carbohydrates, like that on a chip, it probably won't do it. But if you take it with like cheese or some type of fat where the stomach has to work harder or some type of protein, then you probably won't get that same reflux.